Parts of the faculty practice have been converted to specialty rooms to treat patients that are either COVID positive or suspected to have the COVID virus. As per the protocols we are sending out, this will be for scenarios 2 and 3. That is, a scenario with a patient who is COVID positive or has symptoms or risk factors that is present for either an exam, consultation, or urgent follow-up, or any patient that is undergoing an aerosol generating procedure. The two treatment rooms are normal pressure, or if you will, positive pressure rooms, while the hallway is a negative pressure hallway, or SAS. All of these areas should be considered contaminated when working in the area behind the plastic door. Before using this area, it's very important to look at the monitor that's situated outside of the plastic door, separating the regular clinic from the area which is under negative pressure. The reading on there should always be more negative than 7.5. If you see that it is less negative than that, be sure to notify either a personnel in the department or building services, as the system is not functioning as it's meant to be. The plastic door to enter the negative pressure hallway has a zipper on each side. It is important to remember, if this door is not closed properly, there is no negative pressure inside the hallway. Therefore, any aerosols that are generated within those rooms can then exit into the faculty practice and contaminate the whole area. Therefore, this area should be sealed as much as possible, only open to let in people into the negative pressure hallway and out. The device that is creating the negative pressure in the hallway and keeping all of the aerosols out of the clinic and department is this HEPA filter, which is connected in the last room in the faculty practice. This device should be always on, and you will not have to turn it off or on. The exhaust from the HEPA filter is going out of the window and removing all particulates and aerosols from the air. So if you refer to your documentation, there are 3 scenarios that are being set out on how to use the infrastructure set up in this clinic. Scenario 1 is for all patients that are asymptomatic or have no risk factors who are here for a consultation or for an emergency visit. And scenario 2, which is for any patient displaying any signs or symptoms of COVID infection or COVID positive status, presenting for a consultation, follow-up, or for an examination for emergency. And finally, scenario 3, for all or any patients who present to the department and require an aerosol generating procedure.
All aerosol generating procedures require an N95 mask, whether the patient is COVID positive or COVID negative. In order to be able to best control the aerosols that are generated by these procedures, we need to leave the doors closed at all times. That means that in room NP1 and NP2, both of them need to have the doors closed during procedure, and also to minimize the entry and exit from those rooms.
It's important to remember, any patient who is COVID positive and or suspected to be COVID positive should always be wearing a mask. You should always remember that these patients' hands are always considered contaminated, and therefore anytime they walk into the procedure rooms, NP1 or NP2, you should ask the patient to wash their hands thoroughly for 20 seconds, and we should also be asking them to wash their hands at the end of the procedure as per the protocol. You should always remember that the only way to get transmission of COVID-19 is if you have your hands contaminated and touch your face. Therefore, it is critically important to always remember to wash your hands after any potential step where you may have contaminated them by touching things in the contaminated area.
It is important that after each AGP, we must wait at least 3 hours for the droplets to settle. At that point, then, the maintenance crew can come in and clean the rooms. Once the procedure is done, instruments must be left behind, and everyone must exit the SAS. Then maintenance can actually be contacted at 23456, and informed that after 3 hours, the rooms can then be cleaned. It is important also to hang on the wall or on the door the instruction for cleaning the room.